Hi, I'm Bryan Zobeck, clinical pharmacist at KSB Hospital and assistant professor at the College of Pharmacy at University of Illinois, Chicago. And today we're going to talk about keeping medications affordable. So we're just going to talk about quick tips and tricks that you can do to help keep medications affordable because this is an issue for a lot of patients. A recent study suggests that more than 50% of patients have trouble affording their medications or would want their medications to be less affordable, meaning that they actually have to make some sort of change in their other budgetary constraints to afford their medications. And if you're in this boat, you're not alone. Like we said, more than 50% of patients report that. And if you think that medications are getting more expensive, or if it feels like they are, it's because they actually are. Here are some medications. Sovaldi, a medication to cure hepatitis C, costs $81,000 for a year-long course. Again, that cures a disease that was previously very difficult to cure. Repatha, a medication to treat high cholesterol, costs almost $6,000 a year. And Orkambi, to treat patients with cystic fibrosis, can cost over $250,000 a year. So medications are becoming more expensive. As illustrated in this graph, looking all the way back to 2013, illustrating the cost of generic medications in yellow, brand name medications in blue, and specialty medications or higher cost medications in red. And what pops out at you is, one, the red bars are increasing and they're much higher than brand name and generic medications. So specialty medications are becoming more common and they are very expensive medications and their prices are rising. Looking at the yellow bars of generic medications for a year's worth of generic medications, those actually are decreasing or staying stable in cost. And looking at the blue bars, brand name medications, those are increasing. And rule of thumb, any brand name medication or any medication that you see advertised on TV at this point is probably a base of $300 or more per month. So we're talking about significant cost to be able to afford many medications for anybody in our society, but the vast majority of patients for sure. This is a major problem because it leads to patients not taking their medications. A recent study by Journal of Internal Medicine talked about or pointed out that 20 to 30% of all prescriptions are not filled. 20 to 30%. So 1 out of 4 prescriptions in the United States is not even filled. And then half of patients report taking their chronic medications differently than directed. When they followed up with a question, they asked why. Why wouldn't you fill the medications? Why wouldn't you take them as directed? By far and away, the leading reason is cost of the medication itself. That was more than double the next closest reason why patients didn't want to take the medication. And then this causes over 100,000 deaths a year, just patients not taking medications. Like someone died and that death could have been prevented by taking their medication. It contributes to 10%, 1 out of every 10 hospitalizations in the United States, and then costs $200 billion just in healthcare costs. That, of course, doesn't count lost productivity or being away from work or needing additional help that's not healthcare related. So significant deaths, disease burden, and costs because we're not taking our medications as prescribed because they're not affordable in the first place. So what can we do about it? I wish I had some sort of magic crystal ball or a closet full of expensive medications or access to drugs at an affordable price, but unfortunately I don't. But we will talk about several tips that anybody can take to help keep their medications affordable here today, starting right now. So the first thing a lot of us think about is, well, I can just ask my physician or my medical provider if they have drug samples and they can just give me a free little supply. So drug samples are a double-edged sword. They're helpful, but they can be hurtful. Drug samples are a limited quantity. They don't give out 6 months at a time. So if you're taking a medication that you're going to be taking for a long time, a sample maybe will get you through for a little while, but probably shouldn't be used for long term. Samples can go away at any moment. So the reason that drug companies do this is presumably to get patients to take their medications. Samples can be used for beneficial reasons or for perfectly legitimate reasons. For example, if your provider wants you to be on a certain medication, But before you go pay $300 or $400 for the supply and then have a side effect to it based on your first dose, you have a side effect, you can't go and return that medication out to the pharmacy and get your $300 back. So samples are a way that a provider can make sure the patient can tolerate a medication before they go and commit to a long-term supply, for example. Another way that we can lower the cost of medications is coupon cards or savings cards. And these, again, are a double-edged sword. They're a tactic by drug companies to get people to take their medication. It makes it easier to get into the medication. And then, of course, if the medication works, harder to get out of. So these cards work for private or commercial insurance. They do not work for Medicare or Medicaid, so any sort of government-sponsored insurance. They usually work to limit the cost of a medication down to a certain price or by a given dollar amount. So in this, we show a Contrave savings card. It could be any sort of medication. If you look on the back of most of these cards, they will say a maximum benefit of $100 or $200. So if you have insurance and this medication would normally cost a $100 copay, this may reduce your cost up to $200 down to a $5 copay. If you don't have any insurance at all, or are in the yearly deductible for your insurance, and this Contrave medication cost $500 full price, regardless of what your copay is, the printing on the back will show that you only have a $200 benefit, which then may reduce the cost from $500 down to $300, which still may be unaffordable. Patient assistance programs are available from drug manufacturers directly, and they're a good option for low-income patients, but you have to prove that you have limited assets and low income. You have to supply tax documents, and then the decision to provide free or low-cost medications could take 6 to 12 weeks. So if you need a medication to start right now, this isn't a good option, but if you can afford to take it short-term and have limited assets, this is an option to get a higher-cost medication for less money or no money long-term. And then, of course, these programs are subject to discontinuation as well. One thing that I tell all patients is to be your own advocate. If you take a medication that's unaffordable, or if medications costs are a significant barrier for you, you should let your provider's office know or your pharmacist know. We don't want you, no healthcare provider wants you to be taking medications that are unaffordable for you. There are oftentimes other available medications to treat a condition that may be at less cost. And then if you ever receive a medication that's cost prohibitive or too expensive for you to take, ask why it's so expensive. Ask if there's other alternatives out there, because oftentimes there are. If you don't have prescription drug insurance, you should get prescription and drug insurance if it's available to you and affordable for you. Oftentimes, patients are not taking prescription medications currently, but then a major health consideration comes up. You don't want your health to be jeopardized by not having appropriate insurance or ways to pay for healthcare. So you should be looking into getting prescription drug insurance, especially with some of the sticker shock that we saw in the earlier slide of some medications costing $250,000 a year or more. Lots of people interact with their prescription insurance in negative terms, meaning they only talk to their prescription drug insurance when a medication's not covered, for example, but we forget some of the prescription drug insurance benefits. So the pharmacy benefits manager working for the insurance company is negotiating prices with pharmacies, with wholesalers, and with manufacturers of medications to help keep prices low. So again, pharmacy benefits managers and insurance are doing something on the positive side for patients by negotiating prices and trying to keep them low, but of course can be frustrating sometimes when you only hear that a medication isn't covered by your insurance. This is an example of knowing your insurance. So you have to know if you have a yearly deductible. You have to know your out-of-pocket maximums. This will help you make decisions related to medications if you get prescribed a medication that is a relatively high cost. This example shows Medicare. In stage 1, you have a yearly deductible. That's where the patient has to pay the full expenses. You get to initial coverage phase where everything's covered. Then in Medicare, uniquely, there's a donut hole or a coverage gap where the patient then has a higher cost responsibility. And then you get to the other side of the donut hole in blue where the insurance coverage picks up again. But if you know this, then you can plan accordingly and you can buy the insurance coverage that's best for your needs. Generic medications are a wonderful tool to help keep medications affordable. They are the same medication, quantity, and route of administration as brand name medications. They work the same as well, and they actually have to show that they produce the same blood levels as the original brand name drug. They cost 80 to 85% less, and looking at brand name meds versus generic meds in terms of prescriptions and cost, we see that 11% of all prescriptions written are brand name, which means 89%, almost 9 out of 10 medications in the United States are generics. But yet those brand name medications, that is only 1 out of 10 prescriptions, account for 3/4 of the cost. So anytime you can get generic medications to treat your condition, that is more affordable than brand name medications. Sometimes you may not think that's possible. In this case, vilazodone or Vibrid does not have a generic available, but if it's being prescribed, so it's expensive, it's $300. But if it's being prescribed for depression, there are other antidepressants, maybe not vilazodone, but other antidepressants that could be considered. So talk with your prescriber about different options. One of the most underutilized tools for keeping medications affordable is a medication formulary. This is a big document that comes with your prescription drug insurance information. It's a list of all the medications, both brand and generic, and it outlines what tier they are, and tier is associated with how much they cost. Lower tiers, lower cost; higher tiers, higher cost. This is an example. Tier 1 is generic. It has the lowest cost. Tier 2 is preferred brand name drugs. Tier 3 is non-preferred, so more expensive brand name drugs. And Tier 4 would be specialty medications and would be the most expensive. This is a screenshot of a formulary, and you can see they have the medication listed to the left. On the middle column, they have the tier 5, 4, 3, 2s. And so if you can find a medication that would work for you, or if you and your prescriber can work together using this formulary document, this would be a way that you can find a medication that is going to be affordable or covered by your insurance. I take my formulary to every physician visit or doctor's visit that I go to, because if that provider wants to prescribe a new medication, I want to hopefully be able to know how much it's going to expect before I get to the pharmacy. If you are in a situation where you have to pay for medications yourself, meaning you're in your deductible, you have a high deductible health plan, you're in the Medicare donut hole, basically you, the patient, are paying the whole price, it pays to cost shop. So this was actually a Consumer Report study that took 5 different generic medications listed in red along the top to about 10 different pharmacies and looked at the price per month of how much those prescriptions would be. And you can see that the cost varied widely from $200 to $900. So if you're paying the full cost of medications, not just co-payments, but paying the full cost, it pays to price shop. If that doesn't work, I've got 2 examples. So my grandma, she was on gabapentin. She was switching insurance. It was going to be tier 3. It was going to be $45 a month. Or my father-in-law took trazodone for a long time to help him sleep. And if he switched insurance from his private plan at work onto Medicare when he retired, it was going to jump from $4 a month to maybe $30 to $50. So if your insurance doesn't make things affordable, first ask, do you need the medication? So if you take an allergy medication and it really doesn't help that much, maybe you decide it's not worth the cost of the medication. Can you switch to something more affordable? That vilazodone to another antidepressant example we talked about earlier, shop between pharmacies, like we said, and also there's an app or a website called GoodRx. You may have heard advertisements for this. It's a free app. I use it all the time. I have it on my phone. I go to this website. I use it in the clinic to help patients know what to expect for prices and to help get lower prices on their medications. So I looked up trazodone and gabapentin for my grandma and father-in-law. This is a free app. You have to sign up with an account, but you don't have to enter credit card information or anything. There's no money. You don't pay anything. So for my grandma's gabapentin that was going to be $45 a month, now you see that at Walmart it's $11.50, and you can see prices at other pharmacies. And for father-in-law's trazodone to help sleep, you can see that different pharmacies have much lower prices than the $30 or $50 copay he was going to pay on insurance. So this is a good app. Healthcare providers use it. Don't be afraid to use it. It's not a scam. It's not a ploy. It's not insurance. You don't have to pay anything. It's a way to increase transparency of medication costs, so you know what to expect when you go to the pharmacy. So in summary, tips to keep your medications affordable include being your own advocate. Don't ever let cost be a barrier for you to get the medical care you need. Try to take generic medications when possible. They work and they save a whole lot of money. Get prescription drug insurance if you can, if it's available for you. Know your prescription insurance and how to use it and how to leverage it to benefit keeping medications affordable for you. And price shop for generic medications, or use GoodRx app or website to help you keep medications affordable. As a clinical pharmacist, we have patient visits. We're happy to review your medications to optimize them for safety, efficacy, and cost. I'm personally located in Town Square Center, KSB's Town Square Center in the lower level. The visits are always free, and we don't change anything with your medications at these visits. We look for ways to optimize medications and then communicate those ideas to your medical provider so that the next time you see them, you can have a discussion with them about optimizing the medications you use. So give me a call at the number listed at the bottom of this slide to schedule a visit. It's always free, and it's in the lower level of Town Square Center. If you do have any medication questions, feel free to reach out to either me or, of course, your medical provider, because keeping medications affordable is a key factor to promoting health and wellness.